Hello everyone, I'm Betsy from Montgomery APC. In our previous video, we spoke with Dr. Jeffrey Herman from the University of Maryland about the importance of using modeling in public health emergency planning. But in this video, we wanted to take a look at how someone would begin to use it. Today in our Montgomery APC Shorts video, I will be talking with Rachel Abbey, the Program Manager for the APC program. We are going to discuss some of the steps planners may want to take before using the Clinic Planning Model Generator. Rachel, there are many models in the field already. Why did Montgomery APC develop this model?
Montgomery APC developed the Clinic Planning Model Generator in collaboration with the University of Maryland, basically to develop a model that can be used by local health departments, and it was easy to do.
What are some of the key items that planners would need to bring to the table before they even start thinking about using the Clinic Planning Model Generator?
You know, that's a very good question, Betsy. I mean, one of the key things that planners really have to look at is why are they developing the model? What type of event would they be utilizing this model for? The type of staffing that they would need, the size of their population, you know, whether it's 50,000 or all the way up to 1 million population. And what, you know, planners need to keep in mind is whatever the inputs are is going to affect the outputs.
Can you describe some of the outputs the Clinic Planning Model Generator can provide the user?
Absolutely. Some of the outputs are going to be things such as the throughput, how many people you can serve per hour. And then also the amount of direct service staff, so the folks that are on the front line, your vaccinators and your screeners, for example.
So my understanding is that information can then help the planner decide if they need to go back, change an input, and then the model also highlights areas that may become bottlenecks, which demonstrates to the planner, again, where changes may need to occur. But could you also use the model for planning routine clinics?
Absolutely. I know here in Montgomery County we utilize the model several occasions to plan for seasonal or annual flu. It also helps to engage our staff and to get them used to looking at modeling for this purpose.
So what are some of the things here in Montgomery County that we've learned after we've used the Clinic Planning Model Generator?
I think, you know, in Montgomery County we've used the model to help us to explain to administrators the resources necessary to be able to put on clinics, particularly during emergency events. You know, it helps us to identify the approximate number of staff we would need, and then all of the other, as part of the resources allocated to a large effort such as this.
And I can imagine it helps folks really grasp the magnitude and impact of a public health emergency on the community and the workers.
Absolutely, it sure does.
Not only does the model generator help the planner validate their plans, but it also opens up the door for further conversation about resources and expectations. In order to summarize what we have discussed so far, planners need to bring some key data elements to the table before you open the Clinic Planning Model Generator software. They are the type of event, the size of population you are serving, the type of staff, the time frame, and layout and design of the pod. Rachel, these should all be a part of the plans themselves, correct?
Absolutely, Betsy. The Clinic Planning Model Generator helps to validate your plans and other response efforts.
At this point, there are two additional parts of the Clinic Planning Model Generator that Rachel and I would like to point out because we think they are extremely useful for the planner who may be using the Clinic Planning Model Generator for the first time. The first part is the user guide that was developed for the Clinic Planning Model Generator and covers step-by-step how to use the model. The second, which you see here on your screen, is the worksheets that are contained in the user guide. The worksheets help the planner to match up stations listed out in the model. Completed sample worksheets are included in the user guide to help the planner. Well, this concludes our second Montgomery APC Shorts on the Clinic Planning Model Generator. Next time, Rachel will be walking everyone through the application online to show you how we use it here and give you some insider tips on some of the sections, including the worksheets I just showed you, on how to use them. If you have any specific questions on the Clinic Planning Model Generator or another Montgomery APC tool, feel free to contact us at the email address at the end of this video. Montgomery APC is also on Facebook and Twitter, so feel free to contact us there as well. You can check out our other pairs of shorts at www.montgomerycountymd.gov/APC. Thanks so much. Bye.